A man comes into ED and develops a fever. A full blood count shows his serum lipase is 3 times its normal limit. He is vomiting extensively and has pain around his sternum that travels to his back. What is your likely diagnosis? Hey guys, how you going, and welcome back to the 7th episode of 5 Minute Medicine. My name is Kay and I'm a medical student who's created this podcast to give you the highest of high yield info on pathologies in only 5 minutes. Go on and give our Instagram a follow, as we'll be posting quizzes from the podcast and notes from the topic to help you excel in your studies. Our app is 5.min.medicine. If you haven't guessed by the case already, today's pathology is on pancreatitis. So what is pancreatitis? Well, pancreatitis is an inflammatory condition of the pancreas. To quickly revise on our pancreatic functions, it comprises of both exocrine and endocrine components. In terms of its exocrine function, it houses digestive enzymes that are stored as proenzymes called zymogens, meaning that they are not yet activated. This is to ensure that these enzymes do not autodigest the pancreas. So this leads us to the pathophysiology. Pancreatitis arises when there is obstruction to outflow of the pancreatic duct. This ductal outflow obstruction leads to early activation of these lipolytic and proteolytic pancreatic proenzymes, destroying the pancreatic parenchyma through liquefying it. This process is known as liquefactive hemorrhagic necrosis. Destruction of the pancreatic parenchyma attracts neutrophils and macrophages. These cells release cytokines, which ultimately cause pancreatitis. An important complication of this process is distributive shock. The mass cytokine release that has occurred can increase the permeability and vasodilation of blood vessels, causing fluid to enter the interstitial space, causing hypotension and tachycardia. This may show as an increased hematocrit concentration on full blood count. So the causes of pancreatitis are super easy to remember through this simple mnemonic: I get smashed. This stands for I being idiopathic, gallstones, ethanol, trauma, steroids, mumps, autoimmune conditions, scorpion stings, hypercalcemia and hypertriglyceridemia, and ERCP, standing for endoscopic retrograde cholangiopancreatography, and drugs. The important takeaway from this, though, is the 3 most common causes of pancreatitis, these being ethanol, gallstones, and idiopathic. So the important symptoms of pancreatitis were all in the clinical case, these being epigastric pain radiating to the back, nausea and vomiting, and fever. To diagnose acute pancreatitis, 2 of the 3 features are required, these being characteristic abdominal pain, an increased serum pancreatic enzyme concentration of 3 times its upper normal limit, these enzymes being lipase and amylase, or pancreatitis on imaging. Now to imaging. Abdominal ultrasound is the first-line imaging for pancreatitis. What it will show is a hypoechoic pancreas through edema and potential cholelithiasis. Contrast CT of the abdomen and pelvis is also done if there is any diagnostic uncertainty or lack of improvement after 7 days. Features include enlargement of the pancreatic parenchyma with edema, indistinct margins surrounding the pancreas, and surrounding fat stranding, this showing grey streaks around the pancreas. An important scoring system for pancreatitis is Ranson's criteria. This can be done on admission or 48 hours after admission to determine the severity of pancreatitis. In terms of treatment for pancreatitis, it can be self-limiting. If this is not the case, it is conservative initially, and then treatment is done to approach the underlying cause. So what does this really mean? On admission, give analgesia. This could be an IV opioid or an NSAID. Fluid resus is also important, and this can be done through a crystalloid. In mild cases of pancreatitis, support eating as usual. Otherwise, provide enteral nutrition through an NG tube to prevent villus atrophy. Then the underlying cause should be treated, and this may involve surgical intervention. Thanks so much for listening, guys. That concludes our 7th episode. We hope that you enjoyed listening, and happy studying.